Hey, nice to meet you guys. My name is Yong. I'm in my third year of college and a third semester nursing student. As a nursing student, I have worked in the adult medical surgical unit for 2 semesters and labor and delivery over the past 2 summer session. This means I have cared for all types of patients in varying stages of life development. I have worked with individuals at the beginning of their life and the middle of it. Some were also in the later stages of life. In this class, Gerontology 400, taught by Professor Lena, it focuses on the importance to those later in life. As a nursing student, we work with geriatric patients to treat their medical conditions, but that's slightly different from what gerontology as a subject is. As defined by the Merriam-Webster Dictionary, gerontology is the comprehensive study of aging and the problems of the age. In this class, I have learned about the biopsychosocial model of aging. This model incorporates multifactorial reasons as to how diseases and illnesses come about. This biopsychosocial model of aging incorporates things like genetics and nutrition, which covers the biological aspect. The focus of our clinical rotation was mainly on this aspect of the model. Many times, those who were at the hospital at this age came in for physical illnesses such as urinary tract infections and community-acquired pneumonia, which oftentimes led to widespread septic infection. In regards to the class, we discussed elder abuse and the treatment of the elderly. Many of the patients come from skilled nursing facilities or SNFs. These facilities usually have inadequate staff to fulfill the need of this population. This leads to abuse, neglect, and illnesses discussed above. This then leads to a strain on the community's healthcare system and have detrimental effects on their psyche. Psychological factors like how thoughts and emotions shape health-sustaining behavior. Many of these factors are overlooked as nurses are trying to tackle the biological aspect of their well-being. I believe the lesson on the quality of life of the elderly population was very important here. I remember discussing the idea of physician-assisted suicide and whether these patients should have free will to make end-of-life decisions. As our population grows older and live longer, there's an increasing number of those living with chronic illness as well. In other words, life is prolonged, but quality of life decreases. The thought process of these individuals may be altered, which would deem them as mentally incapable in the physician's perspective, which is a great example of how depressed or altered thoughts shape health decisions. Lastly, the social aspect considers our environment and rules throughout life. Does the individual feel accomplished or fulfilled, or do they have any regrets? How has aging affected their social life? I learned in gerontology and mental health that lack of social support and interaction is the #1 indicator of mental illness. It really put into perspective for me just how important it is that I try to incorporate conversation into my nursing practice. Now, I have a special guest who is going to answer a few questions about what they learned in gerontology. I would like to introduce my friend Joseph.
Hi, my name is Joseph. I am a second semester nursing student at Cal State Long Beach as well. I moved from Northern California and now I'm living in Long Beach.
So, Joseph, we've just a few questions to ask you. You can answer as honest as you like. First, why do you think gerontology is an important study?
Well, as a student nurse and as a future nurse, I believe gerontology is very important to understand what our patient population is going to be like in the next few years, just because of the influx of the age and the group that we're going to be taking care of. Most of them are going to be in that older population, and understanding the aspect of gerontology is really going to help our practice grow.
I completely agree with you. Like I mentioned earlier, our population is growing older, and that's who we're going to be taking care of when we graduate in like a little less than a year. All right. As a nursing student, you have taken care of a lot of geriatric patients. Could you describe a few of your experiences and, how have your practice changed since you taken gerontology?
Yeah. So working with a lot of the older population, most of them are a lot sicker than, let's say, a healthy 20-year-old in the ICU or on the medical surgical floor for like a broken wrist or a broken foot. Many of the patients that come in who are older, they have many comorbidities such as heart failure, hypertension, obesity, diabetes. On top of that, now they have an infection. Yeah. And it's hard because there's a fine line between the quality of life that the person lives versus how much you're doing. For instance, one of my patients was an older woman, and she had very poor prognosis, and you have to take into consideration not only doing the most that you can, but also making sure that they're comfortable at the end of their life.
Oh, well, thank you for sharing that with us.
No problem.
Well, I would like to thank Joseph for coming in and sharing his experiences and what his thought process is on gerontology. Thank you all for tuning into our video and have a great evening.
Bye.
Bye.